Hello and welcome to NewsMax Health. I'm John Bachman. A new study shows how important it is for men to carefully consider treatments for early stage prostate cancer. 15 years after surgery or radiation treatment, nearly all of the older men in the study had some problems having sex. Here with NewsMax Health to discuss these findings is one of the nation's top prostate cancer authorities, Dr. David Samadi, Vice Chairman of the Department of Urology and Chief of Robotics and Minimally Invasive Surgery at the Mount Sinai School of Medicine in New York City. Dr. Samadi, it's great to see you. In this research, which appeared in the New England Journal of Medicine, it paints a pretty dire picture of life after prostate cancer treatment, with large numbers of men facing sexual problems and urinary incontinence. What is your reaction to the findings?
Well, I think that's one of the biggest fears that everyone that's diagnosed with prostate cancer, of course, they're thinking about incontinence and sexual dysfunction. This study actually came in New England Journal of Medicine, as you mentioned, and one of the things that the audience need to know is that this study actually comes from the VA hospital. They looked at thousands of patients, and what they realized that over time, whether it's radiation or surgery, there were a lot of complications and issues. Mind you that, this was all open surgery series, and we know that in open surgery, it's really difficult to really look at those nerves. You're counting on your tactile feedback and the touch factor, and this is the kind of surgery that we were doing many years back, and it's almost going out of fashion. Reason is because there's a lot of blood in open surgery, and if you can't see well, you have to touch, and this touch factor and tactile feedback is not going to really help us with the nerve sparing and with the continence. A lot of these surgeries were done by residents and fellows at the VA, and it also goes back to many years back. Now, since then, there has been a lot of advances in the field of prostate cancer. We have taken the experience of open surgery, we have built up the laparoscopic experience from France, and now we've done well over 4,000 plus robotic cases, and there are a lot of skilled robotic surgeons out there who know how to save the nerves. Now, the most recent advances in robotic surgery is what we invented, which is the SMART technique. And the SMART technique that is getting more and more popularity out there is that instead of taking the nerves from the prostate, opening the side of the prostate, mobilizing the nerves from the prostate, where you can damage those nerves, I reverse the operation where I remove the prostate away from the nerves. This way, the entire skeleton of the nerves and the sphincter and surrounding tissues are untouched, and now we're seeing about 97% continence, we see about 85% sexual function, and the patients are basically leaving the hospital in 24 hours. What that tells you is that it's not just the robotic technology, it's the experience of the surgeon behind it, dedicated centers where there are surgeons that are doing high volume, over 300-400 per year, and that results better outcome. And that's what we're learning from this. I think what we learned from this study is that we've come a long way in this field where we've taken the experience of open surgery and now we're combining it with our fancy technology, and the patients are really enjoying a better sex life, enjoying better continence. Typically when I see these patients in the office, within 6 weeks to a month or so, they are gaining their continence and their sexual function. So we've come a long way in this field.
And so you can't have it both ways if you have the right surgeon. Obviously, there's no substitute for experience here. Now, when we talk about early stage prostate cancer, is it generally overtreated, and why? And if so, why is that?
It's an excellent question, and I truly believe that it is overtreatment, and partly because our diagnostic tools are really weak. We're talking about when somebody goes with an elevated PSA or a prostate nodule, they end up getting a biopsy. These biopsies, it's important for people to know that they're random biopsies. Your doctor is taking certain samples of your prostate from different part of it. Now, if you get the same biopsy a week after or 2 weeks after, you may end up with a completely different results. I think the fear that a lot of times we remove the prostate before the surgery, there could be a low-risk prostate cancer, but after surgery, we find a lot more cancer, much higher amount of volume of cancer, and also more aggressive cancer. That's the reason why there's overtreatment and overdiagnosis. The day that comes that we would have better imaging and better diagnostic tools, I think those numbers will go down. There's also a lot of studies coming in genetics, trying to find out who is really at high risk and who is not. Then we can really decide who should get the surgery or not. But in general, I think it's important for people to know that when you remove the prostate, unlike radiation, you get a very accurate staging. You will find out how much cancer you have, what type of prostate cancer, and other treatments like cryotherapy or radiation and HIFU won't give you that kind of answer.
Now, I want to focus a little bit closer on the factors that go into determining whether a prostate cancer patient should have surgery, radiation, or no treatment at all, and undergo what is called watchful waiting. Talk about those factors.
I think what we know is that if you're much older, you have a low-risk prostate cancer, your PSA hasn't changed for a long time, you may have medical issues such as diabetes or heart disease, that patient would be a fantastic patient for what we call a watchful waiting, or better term is close surveillance. What that means is that he needs to come into our office every 3 months. If the PSA continues to go up, there would be multiple biopsies in the future. And the major condition for that is that the patient needs to be compliant and follow up. If the patient is not compliant, close surveillance would not be a good option. When it comes to the decision of radiation versus surgery, and now there are other options, there are completely different options. In surgery, you basically remove the entire prostate. You will find out what your accurate staging, your precise staging is. What does that mean? How much cancer do you have? Is it 30% of your prostate, 80%? Has the cancer gone into seminal vesicles or surrounding tissues? What's the status of lymph nodes? And of course, moving forward, your PSA should be always 0 and undetectable. So you are in charge of your life. If the cancer comes back after surgery, you can still have a plan B, which is you can get radiation after surgery. When you talk about radiation as a first treatment, that's a totally different world. We don't know exactly what the stage is. We're basically going with what we found on the random biopsies, and I certainly don't want to risk my life on some just random biopsy that somebody did. So you're radiating the prostate, not knowing what the seminal vesicle condition is, what the lymph nodes are. If the cancer comes back after radiation or HIFU or cryotherapy, surgery will not be a good option for you. You have burned too many bridges. And so we got to be very careful. The follow-up after radiation is also very difficult because the PSA is not going to be 0. So I think more and more people who are educated, are reading about this, they're finding out that in the hands of experienced surgeons, where the quality of life as far as sex life and urinary control is great, removing it, putting it in the bucket, making sure that there is no cancer left behind, with an easy follow-up and all options ahead is the way to go. And of course, robotic surgery is becoming more and more popular in 2013.
Well, you were at the forefront of the robotic surgery revolution. You're a pioneer in this field and one of the experts, one of the best in the world. What are some of the advantages? I know you talked about this before, but let's just go over it one more time, of robotic surgery, especially in 2013 compared to more conventional surgery.
Well, you know, with the new and latest smart technique, and there's a lot of information on smart-surgery.com, what we have done is we really have saved the sex life for a lot of men. Now we see patients in their early 40s and 50s, and sex is a big part of this. And I really want them to make sure that they have quality of life. Urinary control is a big part of this. So we are able to really preserve as much urethra for them, so they're able to get rid of those pads very soon. So what we see is that the surgeries are now in our hands is about an hour to an hour and a half. Patients stay in our private floor one night, they go home the next day. The catheter duration is much shorter, pain is minimum, getting back to work is much faster. There hasn't been any transfusion for the last 6 years. And I think that's really one of the medical miracles in this country. And now we're seeing a lot of patients coming from all over the world to US to seek our expertise. And that has revolutionized the field of prostate cancer in 2013.
And patients can get back to feeling like a man again, which has obviously emotional, mental, and health benefits as well. Dr. David Samadi, great seeing
100%.
you, great talking with you. Hope to talk to you again soon.
Thank you so much.